Dr. Tanarak, I hate to say this, but by having you back on our program is only a reminder that we are not yet out of the woods. No,
Right.
okay, but things have been improving. But let's start with some good news, Dr. Tanarak. Are we still on the right track in dealing with the pandemic?
We are doing great. If we look at the situation in the countries, since May 25th, we did not have a local transmission case reported until September 3rd. And that September 3rd was only one sporadic case. We are now trying to investigate the incidents. We may identify a few more cases, but it has not been yet confirmed. So far, I think we are in a very good situation. Situation in the countries look very good. Situation around the countries may not look that good, but up until today, we start to see more and more risk of importing patients or confirmed case from other countries. So that is something that we have to be very careful about and try to look at the situation and adjust our strategies accordingly.
I believe that the country you mentioned must be Myanmar, our neighboring countries. And during the CCSA press conference today, Dr. Tuvisin mentioned that we have 10 provinces connected with the Myanmar side. So what should be the strict measure in order to contain infection that may come from Myanmar?
The Myanmar, if we have a case from Myanmar, generally it will be coming from the illegal migrant workers or illegal laborers who come into the countries. I think what we should do is take instead of relying ourselves upon the policemen or the soldiers who patrol the borders, I think everybody should join hand in hand in trying to solve this problem. The private companies or the private sectors also have the roles to play. If they did not really accept any illegal migrant workers to their companies or to their factories, I think that will reduce a lot of demand because generally the illegal migrant worker from Myanmar is not the same as the Thai laborers who can come in and shopping for the workplace. Usually they know where they need to go, and then when they know exactly where what factory is now looking for the laborers. So if there is a less in demand from the private sectors, then I believe that there will be less and less Myanmar migrant workers who like to come into the countries. And if everybody's from the factories into to anybody who work as a drivers or as anybody who take the Myanmar laborers into the countries, stop doing that as well. I think that will reduce quite a lot of things. And the migrant health volunteers is also one of the component of the health system that we design in order for us to help detect abnormalities of the situation in the migrant workers. So at the moment, if everybody's work together, health sectors, the police sectors, the government sectors, private sectors, and also the American health volunteers, then I think everything should be fine. But it needs the whole government and whole society approach in order to slow down or to solve the problem.
There have been suggestions that Thailand may want to consider sending medical personnel or medical facilities to help our friends in Myanmar to cope with the pandemic. Do you think that is a possibility?
That is actually the strategy everybody considers. But that's really depending on the government talking between the Thai government and the Myanmar government. The best ways to solve the issue is to stop the epidemic at its source.
Yeah.
So if there is any outbreak in Myanmar, the easiest ways for Thai actually, instead of just to prevent it in Thailand, is better if we can help Myanmar solve their problem as well. So if Myanmar can control the situation, then there will be no risk or less risk in Thai side. So the ideas of helping Myanmar in any ways that we can is one of the strategies that we consider.
And what about the extension or granting special tourist visa to Thailand? Dr. Thanarak, do you see that it's the right timing to have more foreign visitors? And what should the local do more in order to cope with the COVID-19 pandemic?
Okay. We all know that about 15% of our GDP is with the tourist industry. So the decision of CCSA to open up or to try to encourage the tourism by encourage the travel into the countries, but still with a very safe approach. I would say that any tourist who come in need to have 14 days quarantine. That is the safest approach we can do. And in trying to encourage or trying to stimulate the tourist industry at this time, I think is the right things to do. With starting from the lowest risk approach, then probably if it's work, we may consider other strategies. Again, the other strategy is also a safe one, but we may need to do it in order to stimulate or to encourage the tourists from other countries to travel to Thailand.
I see. The World Health Organization is now working with about 170 countries on this project called COVAX to develop and distribute vaccine and the anti-COVID-19 vaccine to be sort of a common drug to be distributed to people around the world. Is Thailand part of this effort?
Yes. Actually, the Thai government, the Ministry of Public Health, is trying everything. If we follow the news, the Minister of Public Health, Kun Anutin, is work very hard on this. We have a meeting with several countries who is the front runners. We approach several companies. The National Vaccine Institute also having negotiation and discussion with several vaccine companies. So we are taking several approach. COVAX is also one of the approach we are doing. We approach the AstraZeneca, the front runners who has working on the Oxford vaccine, so that we can have the technology transfer. If that is the case, then we probably be able to manufacture the vaccine in our countries. We are trying to approach other company as well in order to have the vaccine review or manufacture in the countries.
I see. Now, with this kind of international efforts, how optimistic are you in seeing a COVID-19 vaccine available in the very near future?
What we know is that by the end of this year, several companies are very positive that they are going to get the result of the vaccine. But we have to understand that the phase 3 vaccine has just started a few months ago. So if by this year we get the result of the vaccine, this means that it should be what we call the just 6-month effectiveness result. What we know so far is that the US FDA has announced that if any vaccine has about 50% effectiveness in 6 months, they are going to approve those vaccines. That's also said that the vaccine has to be safe. So in the end, well, they are going to approve the vaccine, but in the end, we have to wait and see how long the vaccine has a protection for the COVID-19. What we would like to see is the effectiveness at 1 year, not just 6 months. Let's say that if at 1 year, the effectiveness of the vaccine is 50%, then we can plan on what we should do next. The times of the period of the vaccine effectiveness is to also tell us how often we need to vaccinate the population. So let's say if the result of the vaccine said that, well, at 6 months we have about 70% effectiveness, and at 1 year if we have about 50% effectiveness, we know that at 1 year we probably have to revaccinate anybody who has been vaccinated before because of the decline in the immunities. So those kind of results we need to take into our consideration on what we should do with the vaccine that will be available very soon.
And Dr. Tanarak, in terms of figures from COVID-19, is quite alarming because as of now, the total number of infection around the world is 33 million. And the number of death cases is more than 1 million already. In your view, how alarming this is? And in Thailand, we talk a lot about probably second wave or third wave. What's your take?
Okay. I believe that the number of both cases and death that report in the news today or in the media today is underreported. As we all know, so for example, one of the studies from the US that's doing the testing of how many people get infected, we know that a lot of people was not reported into the system. Some state the underreport is more than 10 times. So the numbers of the new cases is rising very rapidly, and that is not surprising for the emerging infection. We know that the epidemic will spread very rapidly. It can reach about 50% of the population within 1 or 2 years. So if we are not doing anything to slow down the epidemics, we can expect that there can be more than 100 million people around the world get infected this year. And as I mentioned, 30 million is a lot underreported. And if we say that the numbers that is reporting to the system is 3 times less, it means that probably we should have more than 100 million people get infected up to today. Also, the number of deaths is underreporting.
Yes.
That is not surprising for the emerging infection. I hope that every country will work their best in order to control and slow down the epidemics. And now about the second wave, I would say this: there has been a lot of countries that has faced the second wave in Europe, in United Kingdom, in Spain, France. Those has now faced the second wave, and the second wave is larger than the problem is bigger than the first one. But it doesn't mean that every country will face the second wave, and it doesn't mean that the second waves will always be bigger than the first one. We have seen what happened in Vietnam, and we have seen what happened in New Zealand. Both of these countries is the countries that has controlled the epidemic very well. In Vietnam, in the first wave, they don't have any death, and when there is anything happen, they close down everything very rapidly. In New Zealand as well. If we look at these two countries, we can say that the second wave can come, but if we take appropriate measures, we can control epidemics. And in New Zealand, the second wave is not that large at all. In Vietnam, it takes them just a few weeks for them to control the epidemics. So it is not the nature of the disease that it have the second wave. It is our behaviors. It's what we do. It is not about the disease itself. If we take care of our behavior very well, we still has high caution, we still wearing masks, we still avoiding the crowded places. Then, if we have a new infection occur in the country, it is not necessary that we are going to have the second wave. And if we have the second wave, it is not necessary that we are going to have a bigger problem when compared to the first one. So all in all, it is what we do. It is what the Thai societies will do in order to limit the spread of the disease. It is not just about the disease itself.